It's vacation season, and today we're going to give you some healthy tips for your next trip. And joining us to talk about this is Minute Clinic family nurse practitioner Meredith Dixon. Welcome, Meredith.
Thanks. It's great to be here.
So it's a great time of year because who doesn't want to hit the road, right? Get out there, wind in the hair, let's go on vacation. But before you hit the road, you need to do some things to prepare yourself. And this first tip, this is particularly true if you're going anywhere abroad. Make sure you check with your primary care provider and get all the vaccinations that you may need updated before you go. And then the other one I see, Meredith, people with chronic illnesses. A lot of times you'll go on a trip, whether it's a road trip or you're in an airplane going to some exotic land, and you have chronic problems, whether it's diabetes, heart disease, and you're not prepared. So if something happens and you go seek help, you don't know your medications. So talk to your doctor, and you can actually get even a written medical report of all your medical problems that you can take with you. And speaking of medicines that you need.
Yeah, I think it's a really good idea to do some planning, as you said. So when you're packing, you want to look at all your prescriptions and not leave any at home. You want to actually have a list of those prescriptions and maybe the dosages. So it's something you can easily reference if you get in a pinch. If you have an EpiPen, that's a really big one to have on board. Make sure you check the expiration of that, as well as if you have asthma, your inhaler is another one. Other things that you can do in terms of prevention, first line defense, think about sunscreen, maybe some bug spray, maybe some allergy medication. You really don't want like a sunburn or an allergy infection or a blister of some sort to come on and ruin your vacation.
And a very common complaint that I'll deal with in the emergency department is someone visiting where I'm working, and if you haven't done pre-planning as far as what's going to happen if you do get ill, look into what are the medical facilities in the area that you're going to. And referring to what you said, if you do get sick when you're on vacation, if you have a list of all your medicines and all your medical problems, it's really going to help the healthcare provider that you're seeing on that trip provide better care for you.
And at Minute Clinic, it's a great option. It's a medical option for folks that are traveling, whether it's business or pleasure. So we have 500 access points across 26 states. So and speaking of continuity of care, we're able to, if maybe you live in New York and you're traveling to Florida, we're able to sort of pull up your medical history and incorporate that into your visit that you're there for today. The other aspect is we want to make sure that your primary care provider back at home has that copy of your record. So with your permission, we'll send that on to your primary care provider so that there's that whole closed loop and we can keep up with what's going on with you when you're on the road.
You know, I used to work in an emergency department where we would send the patient home with their history and physical. I would actually print it out and hand it to them. This is a very unique practice, but that way your own doctor knows exactly what happened when you went to see that healthcare practitioner, when you were on the road. And getting back to being prepared on the road, I understand you have a little something.
Yep, everyone in the audience is going to go home with the CVS Minute Clinic Summer Travel Pack.